Well, they say it takes a village to raise a child, but is that village able to take care of our aging senior population? Doctors, hospitals, and nursing homes are bracing for the swell of seniors expected to redefine health care. Matt Markham spoke to Capital Region healthcare providers to see if we're ready to care for our aging family.
The healthcare industry is looking for its own vaccination against a potentially crippling illness. It's brought on by 78 million baby boomers, soon to crowd hospital halls. Seniors are living longer, keeping more elderly people with us than ever before.
As you age, every decade after 55, the frequency with which you use health care grows dramatically, as much as 50% a decade.
The Capital Region statistically has an older population already than others in the nation. While it is expected to grow, the number of doctors may not.
The physician population is made up of the same baby boomers in many cases as the rest of the population, and they're going to age out over time as well.
Ready themselves for extended care. There are already fewer beds for patients. Is this something that the current nursing home or extended care model is ready for?
The part about that worries me the most is the workforce side of that.
Fewer people will also be paying into health insurance plans.
It's not just about that there's a growing aging population, but there's a shrinking younger population.
Studies suggest boomers visit the doctor and the emergency room more often than their parents did and will continue to. Albany Med sees the trend in its departments.
They're in higher and higher demand, it seems like every day.
For instance, 1 in 4 is expected to have diabetes. The price to pay for it is an ailment all its own.
We really just are at a point with healthcare costs that we can't afford to them to become a greater and greater percentage of our gross national product. And state Medicaid systems are really at their tipping point. So looking at how to manage patient outcomes better.
Especially if our neighbors will be looking older sooner.
Baby boomers themselves are going to be very active in trying to shape what health care looks like, what long-term care looks like, because they've shaped everything else.
There are several remedies being tested now before the healthcare industry is too sick to heal. Matt Markham, CBS 6 News.
Nurses and doctors are relying more on technology to keep costs down for families and keep families together at home. Matt looks at the solutions that others are looking at to meet the demands of aging baby boomers tomorrow night right here on CBS 6 News at 11.